Start. You don't look at me. You just look at the definition. Professor.
Hi, good afternoon, everyone. Thank you so much for joining in. Sorry to keep you waiting for a couple of minutes. So I'm Dr. Ayesha. I'm a family medicine consultant at Burjeel Medical Centre in Zeina. And we have a lovely medical center in Zeina. It's COVID-free. We provide facilities to a lot of patients, so please come and visit if you have to. We've got a fantastic bunch of doctors here. So today I'll be talking a little bit about emotional health and well-being, and we will be touching the emotional health from coronavirus perspective. And it is a bit of an interactive session. Grab a pen and a paper. So there are a couple of exercises that we'll do, and feel free to ask questions in between. Just stop me and I'll be happy to answer your questions. And let's see what we can do in this sort of time. So let's start. So what actually is well-being? Now, well-being can be described as judging your life positively and feeling good about it. But your physical or your overall well-being is affected by your physical well-being, your emotional well-being, and your spiritual well-being. So they're all connected, and then you get your overall well-being when you are fit and feeling well in all these departments. Studies have shown, and general life experience has shown, that well-being is associated with a lot of factors like health, your job, your family, and it is also related with economically related benefits. People who have higher well-being have a less risk of getting a disease, less risk of an illness and injury. People who have a better well-being, emotional, physical, spiritual, they have a speedier recovery and have increased longevity. Now, what actually is emotional well-being? Let's have a little look at it on paper. So the definition is, it's a positive sense of well-being which enables an individual to be able to function in a society and meet the demands of everyday life. People in good mental health have the ability to recover effectively from illness, change, or misfortune. So I know it looks all lovely on paper, but what do we mean by well-being? That's what we'll be touching. What do we mean by emotional well-being? That's what we'll be touching today. I want to say a few words about your physical well-being, directly related to the physical activity and how well you're physically feeling. Just remember that everyone can, at any age, can experience the benefits of an increased physical activity. Your age, ethnicity, shape, size should not limit you. And a moderate intensity aerobic activity such as brisk walking is usually suitable for most people. It is recommended that you should at least do 150 minutes of moderate intensity workout in a week, or 75 minutes of vigorous intensity workout. Just to break it down, it should be 25 minutes of an activity 5 days a week, which pumps your heart rate up. That should be enough physical activity. You should also make sure that you reduce the time that you spend sitting in front and sort of lying down. You should break up those long periods of not moving with some kind of activity. Now coming towards mental well-being, which is the main topic today. If you have a little look, mental well-being has sort of 5 bits to it. So first is connecting with people. So you should be able to do that. Second, which we have touched briefly upon, staying physically active. Third is learning a new skill. Fourth is to give to others. To be able to give will do you so much will be so much better for your mental well-being. Then pay attention to your present moment. So this is something we'll be practicing today. It is also called mindfulness. So to be aware of your present moment. So I have a little activity for you towards the end of the presentation, which we can do together to experience, paying attention to the present moment. So mindfulness, what is it? It's pretty much in fashion. A lot of people talk about mindfulness. So what exactly is it? With life, it can be easy to rush through life without stopping and noticing much around you. Mindfulness is paying attention to the present moment and to your own thoughts and to your feelings, and then to the world around you. It can significantly improve your mental well-being. So literally, mindfulness means maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensation, and the surrounding environment through a gentle, nurturing lens. So again, like I said, it sounds lovely on paper, but today you and I can practice just a couple of minutes of mindfulness, and some resources for mindfulness are there, some apps, Headspace, Calms. Then there are so many videos on YouTube about mindfulness. You could Google them, have a little look at them. I'd say practice mindfulness with your family, with your friends together, even for a couple of minutes during your office. Just take some time out, just connect to the environment around you. So if your brain is wandering around thinking different things, you can bring the brain back to the mind, bring the mind back to the body and connect. So let's do this exercise together now. What I'd like you guys to do is relax. Wherever you're sitting, relax yourself. Now bring your attention to your breath and to your body. And you focus all your attention to the here and now. Keep your eyes open and listen from these ears. Look around you. Listen to the voices which are coming. Take a deep breath in and smell around you. What are you feeling in your body now? You're connecting your body to your environment. Now you continue to breathe slowly. In and out. With every breath that you take in, you bring your mind back to your body. You'll see there will be so many thoughts in your brain which are drifting away. You bring them back to your body. This is a very simple yet very effective technique to attain mindfulness. It has only taken us a minute or so and we'd feel connected. So when there's a lot of stress in your mind, things going around, you can just practice this simple activity and then take it from there. Now ask yourself these questions tonight. Depression and anxiety are a big spectrum, okay? So some people may be at the top end of the spectrum and some people may be at the lower end of the spectrum. But these are just few questions that you could ask yourself and see if the answers to most of these questions are yes, then you should do something about it. So has your mood been low for a long period of time? Have you been feeling generally low, down in the dumps? So previously, if you used to enjoy doing an activity, do you not enjoy it anymore? And do you feel weepy or irritable most of the times? Are things getting on the top of you? And do you feel that your self-confidence is low and you have a poor opinion of yourself? With anxiety, some of the things overlap, but do you feel that you spend large periods of day worrying about something in particular? And you're always often nervous and apprehensive and on the edge? Or do you feel that things are getting on the top of you? Some people find it hard to switch off. And do you experience unpleasant sensations like physical symptoms, butterflies in the tummy, palpitations, muscle tension, you feel dizzy or breathless? So like I said, if you answer yes to some or most of these questions, then it's time to do something about it. Now, studies have shown that social anxiety disorder can be attributed to various factors. Some of them are enlisted below. Genetics, observing other people's with anxiety disorder, a traumatic event in life early, parenting lifestyle, isolated bringing, brain structure, social expectations. The list can go on and on. But what we need to bear in mind is that it's natural to feel anxious at some times. But when things get out of control, we should be able to seek help. We should be able to do something about it. Now, I think I'd like to talk a little bit about coronavirus because you can't ignore the elephant in the room. Coronavirus, it's a very challenging time for mankind at the moment. The problem is we don't know what's going to happen next. And as humans, most of us tend to catastrophize things. And then it just spirals out of control. And that just generates natural anxiety. Thoughts like, what if I catch it? What if one of my loved ones catches it? And all of it is very overwhelming for all of us. A lot of the anxiety comes from news as well. So my advice to you is you stay informed, but don't obsessively check the news. So what you could do is stick to trustworthy resources. So the WHO website, the Ministry of Health and Prevention website, the local guidelines, have a little look at them. So only stick to the trustworthy resources. A couple of tricks could be you limit how many times you're checking for updates. So don't obsessively check the numbers, number of patients in the world. Don't do that, especially if it's making you anxious. You should be able to step away from media when you begin to feel overwhelmed. You could ask somebody reliable to share the important updates with you. And also be very, very careful about what you are sharing with other people. Fake news spreads like wildfire, so you may be actually transferring your anxiety to other people, which is not good. So staying informed, but also asking a reliable person to share the updates and trying to stay relaxed. So you cannot control how severe coronavirus outbreak is and how it's impacting our day-to-day life. But what you can do is you can take steps to reduce your personal risk of catching the infection. I'm sure you've heard these things many times, but I'd like to focus on them again. Wash your hands frequently, use a hand sanitizer, avoid touching your nose, eyes, mouth, stay at home as much as possible, avoid crowds and gatherings because it's different to maintain your distance. Then avoid all non-essential traveling, shopping, 2-meter distance between yourself and others. And I think WHO has now reduced it to 1.2, but just distance from others. Get plenty of sleep because it helps with your immune system. So look after your immune health, focus on your diet, your health. So these are things which are in your control. We may not be able to control how bad the pandemic is, but we are able to control these things. So again, avoid contact with sick people, avoid touching your face, wash your hands, 20-second rule, use a tissue to catch your coughs and sneezes. So now one of the coping strategy which I have been told that always works, and I do it myself, you write down your worries that you have about coronavirus or any particular worries. Write down, make a list, write down your problem, then make a list of all the possible solutions. Then you focus on the concrete thing that you can solve or change. And after you evaluated your option, you draw a plan of action, and then you put it away because that's our brain is it's very powerful. So once the brain has read certain possible solutions and options, then that particular worry, when it comes into your mind, you already have an answer to it. So that could be one easy coping strategy. The other very important thing is for your mental well-being, stay connected. Now, Physically, you may be feeling isolated because you haven't seen family, friends for a long period of time. A lot of you would be working from home. You haven't met your peers. Now things are slowly returning back to new normal. So again, I would say keeping in touch with everyone is very important. So with your family, friends, regular chats, video calls. Remember that social media can be very powerful for staying connected, but at the same time, you should be able to log off if it's making you feel unwell or worse. The other important thing is don't let all your conversations be about coronavirus and the situation these days, because emotions are contagious. So if you are feeling anxious, depressed, low, then you may be passing it on to others. So be careful who you turn into. Now, another thing that I always, in fact, I tell my little girl is, you got to stop thinking about what if. So if you're feeling, for example, you have questions in your head and you start thinking, well, what if this happens? What if that happens? Then you spin out into a negativity and you begin to panic. So what you do is don't think about what ifs. You ground yourself to the present. So ground yourself to the present and don't think about what if this happens, what if that happens. So again, bringing your brain or your mind back to your body and grounding yourself to the present. Now, how do we take care of our body and our spirit? You have to be kind to yourself, maintain a routine as much as you can. Take time out for the activities you enjoy doing. In nature, it's amazing. I know it's really hot here in UAE, but perhaps you could go out for a walk early in the morning. Just go connect with nature. Please avoid self-medicating yourself and take up any relaxation practice, meditation, relaxation, anything that connects your body and spirit. That is good for mental well-being. Now I have a few patterns of unhelpful thinking here. So what I've done is, I've made sort of categories of what could be the unhelpful thoughts. And what we'll do is we'll go through some unhelpful thoughts and we'll try and categorize them. And then I'll see if any one of you can come up with an unhelpful thought and I'll try and categorize it for you. So first way is if you get a negative thought, it could be mind reading. So you could be assuming what the other person might be thinking. For example, you may think, my boss thinks I'm stupid or people think I'm weird, whereas you are actually trying to read their mind. The other one is catastrophizing, like I told you earlier. You may think that I might catch coronavirus and die from it. So you are thinking of the worst case scenario. Then focusing on negative. A lot of people do that, including myself. If 10 people compliment you and one person says something bad about you, your brain keeps thinking about that negative compliment and you ignore all the other positive compliments. So that's another pattern of unhelpful thinking. Then is a should statement. So, I should never be anxious. I should be a better person. So people tend to make these should statements. Then is overgeneralizing, which means you think of a situation. For example, you had a colleague in your previous job who wasn't very friendly, and you just assume all colleagues will be unfriendly. So basically, it's overgeneralizing, but based more on assumptions. And then what if statements. So again, what if I get a panic attack? What if I don't make any friends? Then is labeling. So you just attach yourself to one negative thought, like I'm not a good person. So you basically just labeled yourself not a good person, or I'm not a good employee, and you just label yourself with that thought. So whenever you get an unhelpful thought which is causing anxiety or stress or making you feel unwell, you try and categorize. So that's the step one. You try and categorize that thought into any of these categories. So I'll see if anybody has come up with any thoughts that I could categorize. So someone says that what if I lose my job? So that's a good one. Because in today's circumstances, everything's very volatile, it's changing. And like I said, the world is adapting to a new normal. So there are chances that people can lose their job. So this thought would come into the what if. It's a what if statement. So we've categorized into a what if statement because the thought was, what if I lose my job? Now, On that thought, you may be there may be a particular behavior that it's causing, and then it may be causing a particular physical symptom, which may be causing a particular mood, and then that may be causing a full sort of cycle. This cycle is called cognitive behavioral therapy. It's called a cognitive behavioral therapy cycle. So it's a CBT cycle. So that's what we're going to talk about in the next slide. So in this one, if you have a pen and a paper, please write down the thoughts that you've had. So for example, the person who's just shared the thought, what if I lose my job? So if you write down that in the thought section, please see what feeling does it result in. So the feeling can be, it's making you anxious. So your thought was, what if I lose my job? Feeling is, it's making you anxious. And the situation could be, a lot of people are being made redundant in my company because of coronavirus. So that's the situation. The thought was, what if I lose my job? The feeling is you're becoming anxious. Now, what physical symptom could it be giving you? You may be feeling sort of palpitations. You may feel that your heart is racing. So that's a physical symptom. What behavior is that resulting in? The behavior could be you're unable to sleep at night. So now see, in front of you, you have made a CPT cycle based on your thought and the situation. And can you see how they feed into each other? The feelings and the physical symptoms are both linked to each other. The behavior and physical symptoms are linked. They're all interconnected. So for example, feeling, the physical symptom was palpitation and the behavior was not sleeping. So they are connected. So if you're not sleeping, you get more palpitations. The thought was, what if I lose my job? That is directly giving you palpitations. So this is all interconnected. So what you need to do is you got to train your brain to try and challenge that thought so that you can cut the cycle. So you can then just stop this, because this is going to be a spiral and you have to try and challenge your thoughts so they can break that spiral. I've done another example for you here. The situation is you have a work document to complete for your boss. And the feeling that's causing is you're stressed, on the edge, you're uptight. So that's causing physical stomach churns, poor sleep, loss of appetite. So what's that resulting in? You are actually putting off that, working on that document. And the thoughts that are coming into your brain is, I'll be rubbish. I'm going to miss my deadline, and they'll think I'm not up to this job. So again, you see now in the next few slides, we are going to challenge these thoughts. So it would be fantastic if you could take this time and make a CBT cycle. And then on the next few slides, we're going to challenge our thoughts. So I'll make one for the person who said he was going to lose his job. So let's just take 1 minute and we'll do the cycle. Fine. So I've made this CBT cycle for the person who said, what if I lose my job? Making them, it's making them feel sad, causing palpitations and not sleeping. So that's my CBT cycle for today's, for demonstration purposes. Now, what we'll do is we're going to challenge this thought, okay? So now, how can we challenge an unhelpful thought? So I've got a few pointers here, and there are so many things available. There is stuff online that you could do. There is a lot of, like I said, mindfulness activities. There is CBT online that you could do. So all these things can be done before starting medical therapy, or medical therapy can be done in conjunction with counseling and CBT. So now, is there any evidence that contradicts this thought? So my thought was, what if I lose my job? So the evidence could be that I'm still going to work. I've been given some tasks from my bosses to work on for over the next couple of weeks. So that is actually contradicting the fact that I'm thinking I'll lose my job. Next question is, can you identify any of the patterns of unhelpful thinking described earlier? So, I said categorize the thoughts So can you categorize this thought into any of those? Let's have a quick look. In any of these, so I lose my job would come in a what if statement. So again, whatever thought you have written about, can you now try and categorize it into any of these unhelpful patterns? Then are you predicting the future? So most of the times you will be predicting the future. So I am actually predicting future by thinking, am I going to lose my job? And do I have any evidence to suggest that I'll fail? So in the past, have I ever had predicted future and failed at it? So what you need to do is when you are sitting doing this kind of exercise for yourself, you think of any evidence from your past experiences as well and bring them. Now, this is really interesting. So this is one that I would personally practice as well. So what would you say to a friend who is in a similar situation? So if somebody else is experiencing anxiety or stress due to a particular thought and they're worried about it, what would you say to them? So most of the time you're going to say, don't worry, everything will be okay. You're going to be fine. Even if you lose your job, you're competent enough to get another job. You have savings to support yourself. So there's so many things that I'll say to another person who would be in a similar situation. You say it so that your mind and you can hear it. Now, what are the costs and benefits of thinking this way? So the costs are, I'm getting upset, I'm not underperforming at work, I'm snappy at home, I'm feeling low, I'm not sleeping. And the benefits are, I don't see any benefits in thinking of this thought, in thinking about this again and again. And another thing is, how will you feel about this in 6 months' time? So in 6 months from now, how will you feel about this? You're probably going to laugh it off. So always when you get a challenging thought or a thought that is it's unhelpful, you think about how will you feel about it in the next sort of 6 months. And always, is there another way of looking at the situation? You know, that is thinking out of the box. So could there be another way of looking at this? So with this, I would come towards the end of today's presentation. I'm sorry, it's quite a lot to take in because it's quite, we have to make it small so that you're able to absorb things sort of one by one. But that was just a little bit of taster of emotional well-being. Now, in the end, just one slide that sums up a lot that we've been talking about today. It's a public service announcement by the World Health Organization, and it says, be kind to your mind. And the tips to keep mentally healthy during COVID-19, you pause, breathe, and reflect. Keep to a healthy routine. You connect with others. Be kind. Be kind to yourself and to others. And then reach out. Reach out for help if you need it. With this, I'd like to ask if anybody has any questions. Then you can come up with questions. I'd be happy to answer. So there's a question. There's a question that some people are feeling claustrophobic and anxious wearing a mask. And what would you do to suggest? What would you suggest to them? Okay, so it's a very good question. You know, a lot of people suffer with claustrophobia and they get anxious when wearing a mask because we're not used to it. We're not used to wearing a mask and going out and spending our day in it. So what I suggest is, first of all, get yourself a good mask that has a good fit. So there are so many options out there. There's cloth, and then there is, it doesn't have to be a non-rebreathe, N95 mask. So there are surgical masks, disposable one, cloth masks, so many options. Just find the one that suits you. And then you learn to exercise your breathing when you're wearing a mask. So when you're wearing a mask and you're beginning to feel claustrophobic, you take a deep breath. And then you tell your mind that you're able to breathe through the mask and then breathe out. So practice breathing wearing a mask. The second thing that you could do is, if you're wearing a mask for a long period of time, you could take a break in between. So for example, if I'm in an office environment and I have to wear a mask, don't wear it 24/7. So when you go, detach yourself from the environment, take the mask down, take a deep breath. Always tell yourself, because claustrophobia and anxieties are all, like I said, it's all governed by the brain. So if you tell yourself, then you're able to hear it. And you have to trade some comfort. You have to trade your comfort with some safety. So, like I said, we're coming towards a new normal. So you'll have to trade in some of your comfort. But studies have shown wearing a mask does give you protection. So for yourself as well as for others. So I hope that answers your question. Is there any other? There's one more. It says some people are finding it difficult to sleep during this. Okay. First of all, I'd like to tell you, you're not alone. Okay. So there are so many people who are having trouble sleeping these days. I always say that insomnia or sleep problems are not due to just one thing. So I wish it was as easy as fixing one problem and then it gets better. But it's multifactorial. So there are a lot of things. They could be physical symptoms, physical problems. They could be stress, anxiety. It could be environmental factors. So a lot contributes towards insomnia. So certain tips that I could have is there is a sleep hygiene leaflet. Have a little look at that. Spend less screen time, especially just before bedtime. Eat a bit early. Make your bedtime. Stick to a routine. Some people have trouble going to sleep, and some wake up in the middle of the night and then cannot go back to sleep. So focus on which one you are suffering with, and there's always help available. I'm not a big fan of hypnotics and sleep medication, but if you do have to, there are certain medications that you could use to try and help you sleep. But it's more important to be able to practice mindfulness before bedtime and to be able to do CBT or any of the thoughts which are keeping you awake. So that really helps. One of the websites that I mentioned, Calms, that has certain videos that you can watch before bedtime to try and relax and to be able to switch off. So I hope that helps and that answers your question. Are there any more questions? It looks like there are no more questions. So that's about it. That's what I have to share with you. If you have more questions or want to discuss anything about your physical well-being, your mental well-being, come and I'd be more than happy to see you. Come and see me. Come and discuss it with your doctor. Go and discuss it with your own physician. That's important. And look after yourself and stay safe.